Hi babies, my name is Dr. Stefani Kappel and I'm a board certified fellowship trained cosmetic dermatologist in Newport Beach, California. And before I move on, I have to say I apologize because we just moved into a new house and I had to find an empty space and quiet space in the house to post these videos. So don't mind the TV in the background and the lack of decorations on the wall. We're still moving in and kind of getting settled into our new place. But the video I wanted to do today is on cleansers. And the reason why I wanted to do a video on cleansers is because I often get asked this by my patients in my office, how many times a day should they be washing their face or cleansing their face, and which cleanser is best for their skin and their skin type, and do we really need to wash our face morning and night, and why would you have to wash your face in the morning when you first wake up? So I hope that after watching this video, you'll understand a little bit more about cleansers and how their impact is on the skin and why it's important to wash your face and what to look for in a cleanser and what to look out for in a cleanser. So hopefully this video will be useful to you, and just a gentle reminder to share this channel with anyone who wants non-sponsored content by a board certified dermatologist. So why are cleansers important and why do we have to wash our face morning and night? So during the day, our skin is exposed to so many different irritants, pollutants, toxins, makeup, sweat, sebum, oil, dirt, debris, dead skin cells, and what happens is over time it can build up on the epidermis, the surface layer of the skin, and it can cause inflammation. So that can worsen inflammatory dermatoses like seborrheic dermatitis or rosacea or acne. It can clog the pores. It can worsen psoriasis, eczema, atopic dermatitis, perioral facial dermatitis. Look at me sounding like the dermatologist that I am. But it can really ignite the inflammatory cascades in the skin, which can not only exacerbate underlying dermatologic conditions and things like acne and so forth, but it also can exacerbate and accelerate premature aging. So what happens is when you have these irritants and antigens and toxins and pollutants that just accumulate throughout the day on the skin, just from walking around and being in the environment that we live in, there's pollutants and debris that accumulate everywhere. And on the skin, what happens is it can upregulate the formation of free radicals. So what free radicals do is they bounce around the skin, and yes, they can cause precancerous lesions, which we refer to as actinic keratoses or skin cancers, but what it can also do is cause premature aging by degrading collagen and elastin fibers. Remember, collagen and elastin fibers are the extracellular matrix proteins in the dermis, the lower part of the skin, that gives skin the now nice, smooth, bouncy texture. That's why your skin is like nice and smooth texture. That's why kids have bouncy, squishy cheeks. You lose those extracellular matrix proteins over time, and they get degraded and they get fragmented and they're dysfunctional. And so when I used to be a Mohs micrographic skin cancer surgeon and I would look at a ton of skin under the microscope, I used to be part cosmetic, part Mohs surgeon. So it was really fun to look at people's skin under the microscope, that I was doing active, skin, rejuvenating lasers and rejuvenating treatments on. But what happens is, you see the difference between healthy skin and non-healthy skin under the microscope. And unhealthy skin gets degraded by free radical formations and just wear and tear on the skin and those proteins that when they get disfragmented and dysfunctional, don't have that impact on the skin anymore. They're not providing that structural support in the skin. They get loose and they get kind of wispy and they get broken down, and they're still there. They're just not functional and they're not doing the skin any good. It's not providing that structural support anymore. It's causing wrinkles, laxities, pores get stretched out. Acne scars that maybe when you were younger weren't as readily noticeable, they get stretched out over time because all of these fragmented extracellular matrix proteins get just kind of disrupted and they don't function like they used to. So having things like dirt, oil, makeup, debris, toxins, pollutants, even just dead skin cells and just, cellular debris that accumulates over the course of a day while you're at the gym or at work or just living your life, we need to cleanse that and wash that off every evening. Now, some of you might ask, well, then why do we have to wash our face in the morning? You're still going to be exposed to environmental toxins and pollutants while you're sleeping. And even furthermore, as you sleep, hopefully you get 6 to 8 hours of sleep, or hopefully even more than that. I surely don't. I'm lucky if I get like 6 hours of sleep. But while you're sleeping, your body is rejuvenating itself. Your skin cells are dividing. Your immune system is coming and clearing out all, the toxins and atypical cells, and your skin and your epidermis, your dermis, is turning over and it's correcting itself while you sleep. So that's why when you notice in the morning, like, what do you have to do right away when you get up? You have to pee, right? Because your circulatory system is filtrating through your kidneys. Your skin's renewing itself. Sebum is being excreted. And so all that needs to be washed off in the morning before you go on with your day, or before you get up and you go to the gym, or before you pile on a bunch of makeup or sunscreen on top of all the sebum and cellular debris and dead skin cells that have accumulated over sleep, overnight. So, also people who are acne prone, when you have like the hair follicle that connects the pilosebaceous unit inside the skin, you have a sebaceous gland, and there's like a little channel that leads out to the surface of the epidermis, and as your cells are renewing themselves as you sleep, they get these little sticky cells that can basically clog that pore. And what happens is the pores get clogged with all of these sticky cells, and it's not getting desquamated or exfoliating or washed off, and then you get this backlog of sebum that can't make it through the channel, and you get inflammation, and that inflammation gets worse, and then you get a bunch of lymphocytes and PMNs, which are inflammatory cells of the immune system that cause pus and pustules, and then that further ruptures, and then that causes more of an inflammatory cascade. So washing your face in the morning, especially if you're acne prone, is really important. And I always say this even on my Instagram, on my stories, when I wake up at like 5 in the morning and I go to the gym, I'm always washing my face, and I always work out with a clean face, because you don't want to have clogged pores, and you want your skin to be able to breathe, and you want to remove all of that gunk that has accumulated over the night. So many people ask, like, Dr. Kappel, do I have to wash my face morning and night? And the answer is yes. So I wanted to start off this video by saying yes, it's important to wash morning and night. Now, if you have sensitive skin, or if washing your face you feel like is drying your skin out too much, maybe you're using the wrong cleanser, or if that's the case, try to do it once a day. And if you can, maybe pick morning and night. If I had to choose what would be more important, I would say probably at night would be more important than during, in the morning time for washing your face. But if you can't do it twice a day, at least do it once, and then hopefully you can build up a tolerance, or find a cleanser that's gentle enough for your skin to tolerate, to where you can get into the habit of washing your face twice a day. Now, it all depends on the type of cleanser that you're using, and different active ingredients in those cleansers, and how you're using the cleanser. So that's another reason why I wanted to do this video, which we'll dive into as well. Okay, so many of you guys ask, how do cleansers work? And the way cleansers work is they have a chemical called surfactant in them. A surfactant is also referred to sometimes as a detergent. Now I'm going to talk to you guys like scientists, because science and meanings in science will make things make sense, right? So you have a surfactant in these cleansers, and the surfactant has a water-loving head. You can think of it like a little tadpole. The water-loving head, which we call hydrophilic head. Hydro means water, and philic means an affinity for. And a hydrophobic tail, meaning hydro, water, phobic means an aversion to. So you have this hydrophobic tail that loves oil, and the hydrophilic head that loves water and hates oil. So it's a two-component part of this molecule, and the hydrophilic head will help wash away all of the dirt, grime, oil, sebum, makeup that gets washed away and bound up by the hydrophobic tail. So there's two components to the surfactants in the cleansers, which it needs to be formulated in certain ways so that the component can gently bind up all the grime, the dirt, oil, makeup, sebum, dead cellular debris, and grossness and grime on the face, but it also needs to be water soluble so it can get washed away. Otherwise, you're just sliding around a bunch of gunk on your face, and when you wash it off, it's gonna stick to your skin and not get washed off. So it's a really delicate balance, and I only know this because I've had to formulate cleansers myself, and you wanna get a good ratio and a perfect formulation that's going to cleanse the grime off the skin, but not overstrip the skin of its natural moisturization factors. And also, you don't want it too oil-based, because oil-based cleansers, the reason why they usually need a double and triple cleanse is because it breaks it up, but it's just sliding around on your face. It doesn't get whisked away. It doesn't get washed away because it lacks that water-loving head, the hydrophilic head. So when you talk about surfactants and micelles, M-I-C-E-L-L-E, are when these surfactants kind of make this almost like flower-like arrangement, and all the grime has been binded up in the middle of that little micelle, and then the detergents and the surfactants wash it away. Now, it's always better, in my opinion, to have, instead of chemical surfactants, natural-based surfactants. Now, you can find surfactants in things like coconut shells and different natural occurring plants, and that makes it a little bit, more, I don't want to say clean, because we never want to use the word clean in medical grade skincare. We also don't want to sometimes use the word medical grade skincare because it can be controversial, but it's always better to have, ingredients and detergents and surfactants that are derived from nature as opposed to chemical, at least in my opinion. And also it's really important to have that right formulation that's going to cleanse the skin gently, but not overstrip the skin of its natural moisturization factors, and not just slide around and break up and bind up all the grime, but just not get totally washed off as well. So that's really important when it comes to formulating a cleanser. And that's why sometimes when you use cleansers, you're like, ugh, I feel like, yeah, I kind of like got my makeup off, but my eye makeup smeared all over my cheeks now. And it didn't really, I don't feel really clean. And I feel like I need to do a double cleanse, and I need to use my cellular water, and I need to, do a triple cleanse maybe, or it's coming off on my towel even after I'm using this cleanser. Or the opposite is true. Your face is so squeaky clean that you overstripped your skin of its natural moisturization factors and the natural oils and sebums in your face that you want to keep. So it's a delicate balance. And if you've tried different cleansers and you have one that works for you, it's really important to stick with that. And what cleanser works for one person may not work for another one. So it's really important to keep that in mind and just know your skin and how it may change with different times of the year, and different actives that you're using and what your skin can tolerate. But that's the mechanism of action in which cleansers work. So if you can get a non-oil-based cleanser but not too overstripping at the same time, it's really, really important, and I feel is best in looking for that in a formulation for a cleanser. So a lot of cleansers or bar soaps can have a very alkaline pH, meaning their pH is higher, and that can overstrip the skin, and it can also disrupt the skin barrier. So it wreaks havoc on the skin if you're using a more alkaline pH and a cleanser that has a higher pH. And then on top of that, because you're disrupting your skin barrier, you're stripping it of its natural moisturization factors and its natural oils. And then on top of that, you're using a potentially irritant active immediately afterwards, like say, a vitamin C. It can really wreak havoc on the skin, and it can make things like inflammatory dermatoses or rosacea, acne, seborrheic dermatitis, perioral facial dermatitis, and things of that nature worse. Or if you have sensitive skin, it could just completely make your skin freak out. So it's really important to look at the pH of a cleanser and make sure that it's not too alkaline. Make sure it's not too high. My BioCleanse 5.5 by my skincare line, MD Air, is a 5.5, and that's why it's called BioCleanse 5.5, because I wanted to be really mindful of that, because the pH of the skin is really important, and when that gets disrupted and the barrier gets disrupted, that can make active ingredients, which could be otherwise potentially very helpful, very irritating, to where you can't use your actives, or it's making your skin conditions worse. Now, a lot of my patients also ask me, Dr. Kappel, do I need to do a double or triple cleanse? Or I use my cellular water first and then I use my cleanser. Or I use the ZO 3-step cleansing system, which I love. And before launching my own, that was my holy grail, the ZO Skin Health cleanser, and then there's a exfoliating polish, and then there's a complexion renewal pads. There's also the oil control pads. So I don't want to get into it too much. And again, I'm not sponsored by them, and I really just love ZO as a skincare line. You won't find it online a lot because it's basically only in physicians' offices, and they regulate that really strictly. But it really is a great cleansing system. And again, I have no ties to the company, but I really feel like that 3-part cleansing system works well for many people. Is it necessary to have a 3-part cleansing system? And my answer is everyone is different. And in dermatology, this applies to everything. Just like I always talk about when we're talking about vitamin A derivatives, and people say, well, my sister's on a 0.1%, tretinoin, and I can't even handle like a 2% retinol. Everybody's different. Everybody's sebaceous gland density is different. The thickness of your skin is different. What you can tolerate is different. And that may even inherently change with your own skin and your own body with the time of year or your diet or other environmental stressors or factors that are affecting your skin. So to answer the question, is a 2 or 3-part cleansing system necessary? And I'll say it just depends on you and your skin. Now, if you're washing your face and you feel like you still have makeup on or you still have sunscreen on, then yes, a second cleanse may be important, or using my cellular water first may be the answer for you. Now, again, I don't want to talk about my products too much, because the purpose of this video isn't to talk about my products. But ever since I've used my BioCleanse 5.5, the way I use it is I get a damp face and I use just lukewarm water. When washing your face, it's always important to use lukewarm water that's not too hot. And I basically distribute it on, my fingertips, and I do circular motions around my entire face. I don't wash my lashes. I'll talk about that later, because I have lash extensions and my technician makes me use a certain cleansing system for my lashes alone. I know I'm pretty high maintenance, but when I use my BioCleanse 5.5 and I apply it for 30 seconds, and I'm just doing circular motions around my face, when I rinse and then I take complexion renewal pad over my skin, I don't have any dirt, oil, makeup, or sunscreen left on my pad. So when I use my BioCleanse 5.5 with that protocol, it's a single cleanse. It's a one step, because I got so sick of having to do 3-part cleanses, 2-part cleanses, and then not feeling like my skin was clean enough. And then sometimes when I felt my skin was clean enough, then it would be too irritated because I felt like it was stripped of its natural moisturization factors. So I feel to each his own, and just find what's best for you. Now, before I had my cleanser, I loved the Zeo Skin Health 3-step cleansing system, and I used it a lot, and I really love the results of it. Now that I've been just using BioCleanse 5.5 for the last year and a half, I haven't really used that as much, but it's not that I don't like it. For my skin, this one just works better. And for those of you who use oil-based cleansers, just be mindful, you probably will need a 2nd or 3rd step cleanse, because like I said, you have the component of the chemical of the surfactant that's binding up and binding up the grime on the skin, but it's not washing it away. So that's why you'll need a 2nd or 3rd step cleanse. Now, with that said, I always think that it is important to have some type of mechanical exfoliating in a skincare regimen. Again, it may not be for everyone, but for my skin and for most of my patients' skin, we use chemical exfoliants, but I think it's important to use a mechanical exfoliant. If you're using a chemical exfoliant, that should be fine too. So if people are using a mechanical exfoliation as part of their 2 or 3 step cleansing process, to each his own, and that may work best for you. Again, everybody is different. And I see other dermatologists on YouTube with their fear mongering saying, you have to do a mechanical exfoliation every day, or only do it once a week because it's going to destroy your skin, or use a chemical instead of a mechanical exfoliation. You do you. You find what's best for your skin, and don't be bullied or pressured into doing something in your skincare regimen that doesn't really make sense for you. And as for me, I used to use a mechanical exfoliant every day, but now, I've kind of backed off from that, and my skin's doing fine. I'm also using chemical exfoliants every day. So maybe I don't need the mechanical exfoliation, as much as I needed before. So who knows? So I always say, just understand the purpose of, each step in the cleansing system and what it does. And if your skin tolerates it, great. If you feel like you've kind of gotten rid of it in your skincare regimen and your skin's still doing good, you still feel like your pores are small and your blackheads are going away, I feel that that's a good indication that you can do without it. So for me, myself, I haven't really been using as much of an exfoliating polish recently, but that's not to say I still recommend it for some patients who I feel need that as part of their skincare, 3-step cleansing system, especially those who have really hypertrophic sebaceous glands or large dilated pores or blackheads. Okay, so for my acne beauties who struggle with acne, whether it's comedonal acne, inflammatory acne, peri-orificial dermatitis acne, mature acne, people always think that they outgrow their acne when they're in adolescence, but it comes back to rear its ugly head, even in my postmenopausal beauties who struggle with acne. So talking about actives in skincare and cleansers, benzoyl peroxide, salicylic acid, AHAs, BHAs are all really important. So make sure that when you're using a cleanser, you're using a cleanser that doesn't have too high of an active that's going to irritate the skin. Benzoyl peroxide is an important one to touch on, because also, it's important to know that it can bleach your towels and your clothes and your pillowcases if you're not careful with it. But there's 2 different, if you look at it over the counter, benzoyl peroxide acne washes can be a 5% or less, or over 5%, like a 10%. Those are usually more for body acne. So I have some patients who come in using, a 10% benzoyl peroxide for the acne on their face, and it's burning their face off. That's usually more for like chest and back acne and body acne. You never really want to use a 5% or higher on your face, because it can just really be too irritating. And also the amount of time that you allow the interaction between the cleanser and your skin before washing it off is important too. If you're going to leave it on your skin for a longer time, it's going to have a potentially more irritating effect. So just be mindful of that. And for my recommendations, Skin Better Science has an oxygen watch, which I really, really love as well. And before launching my own, that was like my holy grail of, especially like during like the summer months, if I was more acne prone, the Oxygen Cleanser by Skin Better Science has a mix of AHAs and BHAs in it, which have kind of like a slow release. I'm not sure about their proprietary formulation and the technology, but I have read their studies, and I have talked to their formulator, and it does help with a slow release of AHAs and BHAs over time. And it has oxygen in it, which helps detoxify and purify the skin. So it decreases the P. acnes bacteria, helps downregulate sebaceous glands, but it can be a little bit irritating for those with sensitive skin. So just be mindful of that. But I really do love the Skin Better Science Oxygen Cleanser. Now for my beauties with more oily skin, usually gel-based cleansers are a little bit more effective, but you have to be careful that it doesn't overstrip the skin of natural moisturization factors, because those of us with oily skin who use gel-based cleansers and you get too dry and you strip the skin too much and you get that squeaky clean, you don't want your skin to be squeaky clean ever. So what happens is your sebaceous glands will upregulate their production of sebum and oil to compensate for the over-drying effect of the gel cleanser. So just be mindful of that too. And then those of my beauties who have oily skin, be careful with oil-based cleansers. You want to stay away from those because those can, not be very effective. And anyone using an oil-based cleanser cannot be really washing away all the grime from their skin. And my beauties with sensitive skin, be really mindful of fragrances. And I don't feel like any cleanser should ever have a fragrance or a color or a dye to it. Some of them do. Even some of the ones that I've recommended in the past do. Again, the BioCleanse 5.5 doesn't have any fragrance or perfumes. It's cleaner that way and it's non-irritating. And so for those of you who have sensitive skin, even if you just use like a Cetaphil or a CeraVe or a Vanny cream over the counter, that may be best for you. So hopefully after watching this video, you'll understand a little bit more about cleansers and why they're important to use morning and night, and whether, a 2 or 3 step cleansing system is best and what cleanser would be best for you. So let me know what you guys think of this video and drop a comment in the comment section, and let me know what else you guys want me to talk about in my next video. Thank you so much.